So when it comes to LASIK, there are some frequently asked questions. And so in this video, we will discuss some of the LASIK FAQs. And you'd be surprised, or maybe not, how often most of the questions just fall into this very, very small bowl. There aren't a lot of different ones. The most common one by a lot is, does it hurt? And the answer, briefly, the answer is no, it doesn't. Now, the reason that people wonder about this one is because, as you know, eyes are exquisitely sensitive. The nice thing about how your eyes work, though, when it comes to LASIK specifically, is the same thing that makes your eye so incredibly sensitive to just tiniest little piece of dust. Feels like you got a boulder in there and starts pouring water. It's the same thing that makes it so incredibly easy to make it entirely numb, entirely anesthetized. And that's because drops on the front of the eye work completely. And I don't mean like that theoretically. I mean 100% anesthetize the front of the eye, because those nerves are very, very thin and unmyelinated. They're these naked, thin little thread-like nerves on the front of the eye. And so a drop makes it so that they are entirely numb. Now, this is going to sound gross, and I want you to know it does not happen with LASIK at all, I promise. But you could literally take a needle and just poke it right into the front of your eye with these drops, and you would not feel anything at all. Again, does not happen with LASIK or anything even remotely like that, but it's why LASIK does not hurt. There are some folks, and I'd say it's probably about 1 in 5 people, that for the first 2 hours afterwards will feel that eyelashy feeling like they've got something in their eye. It's really, really rare that somebody would describe that as pain, and it lasts almost magically right at 2 hours and then goes away. So if somebody says that they felt theirs or something like that, that might be what they're referring to. If they actually felt the procedure, that's not normal, and so that's not the case for what we do. The next one is about recovery. People want to be back at it and doing their normal things. I don't know of any other procedure that has a recovery. There are other ones that tie it, but it has such an incredibly fast recovery time. And so if you have LASIK at 3 p.m. on a Tuesday, then we tell people to feel fine about going to work the next day, doing their normal activities. We do have a 1-day pulse stop. We check the next morning, make sure everything looks nice. But it's very, very common for people to come in, have their post-op, and then leave and go to work and work their normal work day. As far as exercise, things like that, strenuous activities, fine the next day. There's only a few things we tell people to hold off on for a little bit. We don't want people to swim around with their eyes open underwater for the first week or two. We don't want people to get into a fist fight. Well, really ever, hopefully, but especially not for the first week or two. But there's not a limitation where you have to, be really physically still. You don't have to worry about screen time, things like that. All of those things are fine to do starting the next day. The next one up is what age? So, if you're looking for a specific number, the two absolute best ages possible to get LASIK are age 18 and age 45. If you were like, what's the number one best time to do it? The reason for that is age 18 gives you the longest amount of time of near and distance vision until you slowly start to lose your near vision in your 40s. And age 45 is when we can correct fully for distance and near, and that will last the longest time possible into the future until someday when you get cataracts way, way down the road, older life. Now, the longer answer to that is you want to make sure you're a good candidate. But if you are a good candidate, there's that saying about the best time to plant a tree was 20 years ago or something, but the second best time is today. It's kind of like that with LASIK. I can say firsthand, I've not met a person who will say, I wish I would have waited longer to do this. It's something where once you can see it, it feels really liberating. Now, not every 18-year-old will be a candidate. Not every 45-year-old will be a candidate. But if you're a good candidate, pretty much any age is a fine time to do it. The oldest patient I've had for LASIK, I believe, was 85. He did wonderfully. He'd had cataract surgery before, and it worked out great. So there's it's younger than 18. It's better to wait, and then after that, once you know everything's stable, then you can do that. Next one is, can I have it done again? Does it limit me in future procedures? So maybe I'll write future. So the short answer to this is yes, there's nothing inherently about having LASIK that would prevent you from having LASIK again. One of the things I tell people is that you can have LASIK 2, 3, 4 times if you need to, but once you get past 2, it's probably better to start doing some research and see if you need to find a different LASIK surgeon, because that's not normal. And so there's nothing inherently about the structure of the eye that would prevent you from being able to have an enhancement, so long as you were a good candidate preoperatively. And that's one of the things that you have to look at. It's very, very important in my job that we never paint ourselves into a corner where we've done something and now we don't have a great way out to fix it or to enhance things, or if we need to do any of that stuff. And the same is true. Oh, that works out well, because the next one is about contacts. So the same is true with contacts. Some folks really, really like their contacts because it gives them tiger eyes or blue eyes or something like that. And so people will wonder, will I be able to wear contacts, colored contacts after the procedure? Absolutely. It's amazing how much it's like your eyes are just eyes that work after LASIK. It's not something where you have these it's very special and you can't I can't put weight on my foot the right way, things like that. It's just you are somebody who had blurry vision and now you're somebody who has clear vision. But if you were looking at every sort of should I hold off, every sort of extreme rare circumstance, skydiving, things like that, once you pass that 1 month mark, the way I tell people to figure out, can I do this with my eyes, is, was it okay to do that before you had LASIK? And if the answer is yes, then yeah, you can. Going to the bottom of a pool and opening your eyes, all those things that people are like, what about this thing? There's not really an exception to, I could do this before, but now I can't. And contacts goes right along with that. There are other questions. They are just less frequently asked. They'd be in the IAQs, the infrequently asked questions. And for those, we can answer those specifically at your appointment.